It's just a huge honor to bring back to the show Marie-Laure Pochon, who received an engineering degree from one of the highest Grand Ecole in France and later went on to receive her MBA. She has spent the last 30 years in the global pharmaceutical industry, focusing on large American and European countries such as Pfizer and Merck. Guess why I brought her on? Early on in her career, Marie was handed the responsibility of running a business unit. Following that success, she climbed the corporate ladder ranks to lead the French and European regions, and by her 40s was appointed as the executive vice president of worldwide commercial operations at Lundbeck. Passionate about global health, Marie made the jump to the dental landscape in 2014 with the hope that her leadership would drive innovation and improve overall dental care for all. After a successful 5-year run as CEO and president of the Acteon Group, Marie set her sights on 3Disc, becoming their newest CEO, president, and shareholder. 3Disc is an agile American manufacturer of imaging solutions for dental practices. The company has quickly developed strong distribution networks in the United States, Europe, and Asia, making its innovation solutions available to a growing number of dental practices. She began her journey in 2007 with a vision to design and build imaging products that empower dentists to provide the highest quality treatment and comfort for their patients. When dental clinics choose their solutions, they can rely on their commitments to use their expertise and continuous product development to give them the best value for their investment. The development of their solutions begins and ends with the dentist and the patient in mind, and their goal is to bring the benefits of digital imaging solutions to dental practices of all sizes. With R&D and manufacturing facilities at their headquarters in the United States, sales and support offices in Europe, and a worldwide distribution network, they are poised to provide the best possible local support for our customers. Again, this is not an advertisement. She did not pay to come on this show. In fact, I asked her to come on the show, not vice versa. Marie, it's just an honor to bring you back on the show.
Thank
But,
you.
but
I'm very
before
honored to be with you today.
But before we go on to all the 3Disc, my gosh, you used to work with Pfizer, and everybody on the show wants to know the first and foremost thing is a COVID update. I just took my Pfizer BioNTech in first dose yesterday, right here on the left arm. And I did wake up this morning. I noticed one side effect of hair loss. I'm noticing a little hair that used to be right there. I had a hair right there, Marie, and it's gone. And my gosh. So my first question to you, not to get off topic, but Marie, would you take the vaccine yourself today?
Absolutely. If it would be possible to have it today, I would have it today and in 1 hour. I think it's very, very important. It's very important that we go back to the real life, I would say. Life is not only to be behind screens. Life is meeting people. Life is enjoying being with friends, with colleagues, and building plans. And I think that the vaccines are absolutely able to bring that back.
Okay, well, now I want you to answer one question from my mother. My mother believes the pharmaceuticals are all conspiracies. They're trying to put chips in her head. And my mom is 82 in the middle of the country in Kansas, and she wouldn't take this vaccine if you tied her up and do it. What would you talk to my mother right now? You used to work with Pfizer. Did you think it was a moral, ethical, good company, or was it indeed fact a conspiracy company trying to stick chips in people's heads?
It's not only Pfizer. I think it's most of the pharmaceutical industry, which is really great and making progress. It's clear that you have to know that all the medicines in the world which are marketed today have been through a lot of experimentation, a lot of tests, a lot of clinical proof, and you can absolutely rely on the medicine of today and the drugs of today. I think it's important that the people everywhere in the world believe in this industry, which has made so many progress for the humanity. And I believe in Pfizer. I believe in Merck. I believe in, I would say, very, very much the vast majority of all the pharmaceutical labs in the world.
Okay, Mom, now what I want you to do is rewind this for a minute and listen to it until you get the shot. It's me and my 5 sisters and my brother, our only goal is to try to get Mom, because I keep telling her, I said, Mom, she's worried about some crazy stuff. And I said, well, forget about all that. I know what's going to happen to you if you get COVID. It's not going to be pretty.
No, it's yeah. Can I say to you something? My mother is 99-year old. She got COVID. She went to the hospital, and she is absolutely fine. So it was 2 months ago. We were very much afraid. I can tell you, we were really, really afraid. But okay, it's COVID is painful. COVID is very, very often difficult. But even at 99, you can survive and being good.
Yeah, and my gosh, I cannot wait to get this behind us. Now on to our regular scheduled programming. You were with a legendary. When I brought you on last time, that was in July of 2017, and only 18 months ago. And you were with one of the biggest companies in dentistry. You were with Acetone. Did I pronounce that Acteon? Right?
Acteon.
Acteon. And you were with Acteon. My gosh, what would make someone like you, who was the CEO of Acteon, now jump over to Disc? I mean, and you're a shareholder even. So tell the dentist all about 3Disc. How did it? How obviously they're doing something that you're very passionate about, or you wouldn't have jumped from Acteon.
Yeah. First, I have had 5 years great with Acteon. Very happy to be with them. Very happy to lead the company, and we were extremely successful. I think it's basically a kind of public knowledge. But to be very frank, when I met the 3Disc people management, it was the first time. It was in October 19 in Washington. I thought that this company, which was at that time a pure R&D company, was really, really great. It was not a conventional company. It was not a company with, I would say, the people, the usual people coming from the dental industry. It was R&D people coming from the military environment, coming from the spatial environment, coming from many, many fields in the world, and having the dedication to build the best iOS in the world. And I thought, my gosh, I want to do something with this company. This was a pure R&D company, and now we acquired this company. We being definitely a private equity fund, which name is Acteon, which name is Galliena in France, and me. We acquired this company on October 6, 2020, and the plan is to make it really different, to serve better the customers, to serve and with a product which is definitely different from the others. I will tell you more.
Yeah. When you have headquarters in Washington D.C., and I hope you don't look up the news about Washington D.C. today. It's another embarrassing moment for the United States of America. They're storming the Capitol, whatever. But the last time you were here, but when you talk about headquarters in Washington D.C., the only dental connection I can think of with Washington D.C. is Danaher. So is your headquarters in Washington D.C. because of Danaher, who?
No. It's not because
connection?
of Danaher. The company was you reminding as an introduction that the company was founded in 2007 with 2 locations at that time, with 3 locations. One was in Seoul in Korea, one was in Washington D.C., and one was in Denmark. And probably one reason also of the success of this company in terms of R&D, but just to be very clear, this company from 2007 to 2020 was a pure R&D company. And one of the reasons is probably that this company was driven in 3 continents and 3 parts of the world with complementary teams and with a lot of enthusiasm from everywhere in the world. So, the headquarters is in Washington, which is absolutely the case till today. But now we are in Seoul, in Paris, of course, and in Washington.
Okay. Yeah, that's interesting. That you're the first dental company I associate with Washington D.C. other than Danaher, who spun off their dental division in Vista. which with Amir Ogday, but I guess he's out in
It's not the
York
same
Linda,
part.
California. So now I have a. Is there any other big dental companies in Washington D.C. other than you guys?
Not to my knowledge. Not.
And then the next question I wanted to ask you, because I'm an American, I'm not good on speaking French, but your system, is it pronounced Huron iOS? Huron?
Yes, Huron.
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 And what is that after the bird, the Huron?
To be frank, this is not a name that we created. It's a name that was created in 2014, and I don't know the exact story behind it. What is clear is that today this is the name of our iOS product.
Well, I want you to know that a heron is a large fish-eating wading bird with long legs, a long S-shaped neck, and a long pointed bill, and I love them. So I was hoping that was the official mascot. So is the heron, was that the crux of your excitement to join this company?
Yeah. This product is, if I want to make a little shortcut, is the first 100% digital iOS.
And what's iOS?
Intraoral scanner.
Okay, I'm just clarifying. I got 25% of my audience is still in dental school, so I got to bring out all terms. So
it's the same way if you say iOS or if you say OCAD, but it's intraoral scanner. This is the first and probably the most digital product, iOS product, which exists today. And this makes a big step to, I would say, a new world. Most of the other products are more larger, have more weight, are not that intuitive. They are not, I would say, plug and play. With our product, you open the box, even a 7-year-old child can do that. You open the box, it's 3 minutes, 4 minutes, 5 minutes to the most, and you have both the scanner and the computer absolutely perfectly matches, and you can start scanning. So everything is really, I would say, fully designed. Everything was homemade. And one of the innovation also is the fact that we have a full team dedicated to that service. It means that for us, we want to do the service by ourselves. We feel that most of the dentists are probably reluctant because they think it's difficult to install, this thing is difficult, which is not the case, but you never know. And when everything is not perfectly settled in a clinical practice, it's probably better to be helped. And we will be there. We are there for all the dentists that are and we are ready to spend 3 hours in person in each dental practice to help the dentist to be sure that everything works perfectly.
Well, the reason I brought you back on the show, not because you're just the fanciest person I know from France. There's a thread on Dental Town. It's called Huron iOS Intro Color Scanner. Did anyone try it? So this is a big thing. So let's just go down the question. First, let's address the old people like myself. I mean, I've been using Emperor gum back when it was made in Germany with SP, then 3M bought SP, but I've been using Emperor gum since 1984, and now it's 2020. I'm so old that when I die, they can't even sell me to make dog food. So talk to the old guys. Why would an old guy want to quit using a vinyl polysiloxane or a polyether Emperor gum and go to intraoral scanner?
First reason is that it will make your life much easier. And I think it's the most important reason. It's much easier for you. It saves you time. It saves you, for the patient, it's more comfortable. This is a second reason. And the third reason, it's absolutely more accurate. So it's more comfortable for you. You gain time. You gain time, I would say, 3 ways. The first way is that when you compare the time of scanning and the time of making a manual printing, you gain a lot of time. First. The second, of course, your assistant has not to go to the post office and to do everything with the molds. Second reason, it's very clear for the patient. And of course, when you get the crown, for instance, as it's more accurate, you gain also time. Second reason is for the patient. It's very clear, and all the studies that have been done on that with that regard show it very clearly. It's very clear that for the patient, this gum is absolutely not liked. It's discomfortable, and worst of the worst is that when they have to redo it because, okay, life is unfair. Third thing, it's clear that it's much more accurate. You gain in accuracy basically 20 ratio. So it means that in terms of accuracy, you between a normal manual printing and a scanner, you are absolutely more accurate. So it means that probably most of the time your work, your prosthesis will last much longer.
And I would want to point out that you got to increase the new patient experience and the everyday patient experience, and you don't have to be a dentist for more than an hour to know that when patients don't want their mouth filled with goop. And it comes all back to the fact that you can only live 5 minutes without air, 5 days without water, and 5 weeks without food. It's a rule of five. And when you go to a human and you block their airway with 5 pounds of goop, it scares people, and they're already afraid of the dentist. And then as far as the cost of this machine, which I haven't asked you yet the cost, but I just want to remember the cost. When she tells you how much it costs, how much does it cost?
The cost for a dentist is roughly $18,000.
Okay, let's
Everything
stop.
included, no fees ever. This is a commitment of the company. So it means that you have all the updates, all the release, the new release of the made for the software, for the hardware, for everything. Everything is included, no fees ever. So it's basically between 18 and 19. It depends a little bit of the software you choose.
For 18 to 19,000, but no reoccurring fees.
No recurring fees ever. And you, for that price, you have the computer, which is perfectly designed, totally adapted to this scanner, and the same. It's a plug and play. You unpack, it works.
Okay, but what I want to do to my the kids in school, because like I say, they're very, very young. They're still in middle school. So the accountant's going to give you 3 statements. He gives you a balance sheet, a statement of cash flow, and a statement of income, right? So when she says it's $18,000, that's a balance sheet number. And most people, I guarantee you, Dennis, probably 20, 80, 20 always comes in play. 20% will buy it in cash, 80% are going to lease it. So it's not even the 18,000. But that's a balance sheet number. The next one is the statement of cash flow and your monthly fees. And a lot of these labs, when you send in an oral scanner, they charge you less money because when you for the crown, because when you send in the impression material, they have to hire a human, which is the number one cost. Most studies show that when you buy anything for $1, 55 cents went to a human, whether that be management, employees. People are your number one expense. That's why when I see a lockbox over the thermostat, I'm thinking, thermostat, utilities. I mean, God, utilities aren't even 1 or 2% of your cost. I mean, when you get done paying the doctor 35% of collections, then the staff another 25%, you're at the same average of 55%, which is what we see in the S&P 500.
What we see as an average is basically you are if you are equipped with an iOS and you have I would say a regular practice in the US, you can treat 3 to 4 or even 5. It depends the type of dentist you are, patients more per week for the same time, which is very important because you really save time. This is also a way to make it, as you say, in terms of cash flow, this is also a way to make it better for the practice. This is also very much important. And as you say, normally the prostheses with the lab are everything, the crowns, the bridge, everything is less expensive when you are digital. But I would say, to be very frank, that digital will be, if you ask me, in 4 years, 90% of the dentists will be equipped with a digital scanner. This is clear.
This is clear.
Yeah, this is
Yeah.
clear. And to be frank, also, the COVID has been a fantastic, I would say, push on that, because everybody has realized that digital is the next today. That means this is the normal, the new normal. And it's not normal today. It's probably a little bit of the old world to take a manual printing, and as you say, the patient is uncomfortable, etc., etc. So this is clear that now many dentists will be equipped in 2021 and probably in 2022.
Huh. Nice. Very nice. So it also, I would just want to say, so again, this is not a commercial or anything, but it's faster than an impression. It's easier. The patients like it better. The lab likes it better. I mean, when I talk to Jim Glidewell, I mean, I say, here's what Jim Glidewell told me as a quote, which you can go back and listen to. It says, when old guys like you, Howard, used to always send in an impression, we had about a 6% remake rate. And when the oral scanners come in, it dropped to 1%. So that's that. So I get it. You're a cynical American. You're saying, well, she's selling the deal. Of course she's going to say that. Okay, well, let's look at the other guy at the
Yeah.
other end, the lab man saying, I just dropped my remakes 5%.
Yeah, and when you receive the crown, instead of taking probably 10 to 15 minutes to really adapt it perfectly to the teeth of your patient, normally in 30 seconds, in 1 minute, it fits perfectly. So it's also a gain of time. This is also a very significant, I would say, benefit, clinical benefit for the dentist.
So how long has the Huron been out?
First, I would say Huron has been it has been an R&D program for 7 years. We basically, with 25 full-time R&D people from 12 different nationalities, and during all this time, this product was really, I would say, the objective of that team was not to copy or to get inspired by the other, was really to reinvent and to make it more digital. The obsession of the R&D team is to make it 100% digital. We have no moving parts at all, apart from the fan, of course, because this is the only way. Everything is digital. And this is a major difference. The major difference is the traduction of this is that it's very light, it's more compact, it's more light. It's basically 3 times lighter than some of the other big competitors. I will not name them. So it's a different product. It's a purely digital new world product. The product was presented for the first time to the market basically in New York last year. And now I would say the real launch was occurred 3 months ago in the US and in Canada.
So it's only been available for 3 months?
Yeah, absolutely.
My gosh.
It was pre-launched, to be clear. It was pre-launched to a restricted, very restricted number of I would say dealers and key opinion leaders, because the product had to be totally finished and refined and everything. And now we can say that the real launch occurred early November, and this is clear. And now on the last 2 months, we have sold in the US like I would say several hundreds of them. So yeah, the real launch occurred in November.
And I also want to tell you this, when I say this, I know half my listeners are going to roll their eyes like, oh, Howard. But the pandemic even changes this because the lab people are saying on Dental Town that they've been complaining for 25 years that when they get an impression and there's still a cotton roll in it and there's still blood on it, and it doesn't take a pandemic to realize that I would rather have teledentistry, I'd rather have this coming in digital than complete with a soaked gauze filled with blood and saliva. And it grosses them out. And I don't even know how you disinfect that cotton roll. I mean, most people. I mean, and by the way, you would not believe this. You'll have to do this. When I first got to Arizona, I was having problems with removable partial dentures, and I was talking to this guy at a course one time, and he said to me, he says, "Well, God, Howard, you live in Arizona, down in Nogales. Arizona is the largest removable partial dentures lab in the world, and it's the biggest one in the United States, in the North America, because it's on the border with Mexico. So they collect everything in United States, Nogales, drive it across the border, went to lab. So man, I jumped in the car. I get off Fridays back then. I just took off Friday afternoon, jumped the car, drove down there, and sure enough, these guys were getting 11 to 1,200 partials a day. And I was so embarrassed. I was young, fresh out of school. 90% of the lab scripts were just like lower partial. They didn't cut a receipt. They didn't design it. They didn't mount it. I'm just like, are you kidding me? They're going to get paid $1,000, $1,500 for this. They just said lower partial. And they're like, dude, 10% of the dentists are taking it serious. They cut receipts, all this stuff. The other ones just take a damn impression and send it to the lab. So when I'm telling you, because you might be listening to this thinking, well, no one would send in an impression with a cotton roll soaked in blood and saliva. Dude, your mom did that for 30 years. Yeah, that's right, your mom. The one that you're practicing with. I mean, so I do think this pandemic is going to shut the door on sending in bloody impressions with cotton rolls that are still you can see the blood in it. So is this a would you say that right now, you said you're impressed with the R&D. Would you say this is a done product? It is what it is. If you like it, great, whatever. Or do you see this owned by a company that will just be continuously incrementally improved where
No, we will,
it'll
of course. This is only the start. What I say today is that the product we have today is absolutely working very well. Very, very, very well. It is fast. It is easy to use, easy to scan. So the product is very good. But of course, we will improve. And believe me, I think it's only the very start of the digital world for the dentist and for the labs. So I'm sure that with we are working on many projects with AI and so artificial intelligence, etc. And of course, this is only many things will be improved in the future. And okay, we are happy to be in this race.
I want you to know that I was your first subscriber on Twitter in the United States, and
Okay,
I'm
thank
going to
you.
retweet this. And by the way, guys, thank you so much. I have 27,000 followers on Twitter, and that's just crazy, and it's all because of you. But your YouTube also has some great content on this videos. It's got my gosh, you have oh my gosh, what is it? 6 across 6, 12. You got 24 videos
Yeah.
on YouTube. You got a great YouTube channel. So if you guys go to 3Disc on YouTube, by the way, what do you think that is? YouTube is
We
still
are,
like
we are lucky. We are lucky enough to have the support of some very, very important clinicians in the US. I can name Justin Moody, who is really somebody
Justin Moody.
yeah, of course. He is one of I think the most important clinician in the US, and we have many others. I cannot name all of them, of course, but we are working on a daily basis with many clinicians. We are working with many labs also. We try to listen to all of them and and that's why probably the product is so good. It goes extremely fast. As I say earlier, another thing, because you mentioned the COVID 2 minutes ago, and you said, okay, the COVID and the blood and everything, it's a real issue. We have we have a tip at the end of the extremity. I don't know the word of the device, and this you can easily, it rotates 360, which is very different from the others. And other difference with the others is that you can sterilize it 250 times. So it means that you can really, in your practice as a dentist, you can really treat your patient with, I would say, extremely safe.
Okay, well, I'm worried that you said those nice words about Justin Moody because that's my Fireball cinnamon whiskey drinking buddy. We live in the same town. So my gosh,
Okay.
he's the greatest clinician in dentistry during the daytime, but at night after a bottle of Fireball cinnamon whiskey, I don't know if I could say that. But Justin brings up a very good question because there's two exact different markets with intraoral scanners. It's if you talk to any lab that's of any size, that has over 1,000 clients, they say that 90% of crowns sent in are still just one tooth at a time. America's a big country. There's 321 million people, and only 42. We've never had 45% of the Americans go to the dentist all in a single year. That's the goal from Rear Admiral Timothy Ricks. The goal is that within 5 years, that in a year's time, 45 out of 100 Americans go to the dentist. So when they are going to the dentist, 90% of it is one tooth at a time dentistry. And then you got this, we'll call it and then you got this 5-10% of what I'll call high-end elite Dr. Justin David Moody dentistry, which he's doing, implants and full mouth cases. So would you say did you do this more for the 90% one tooth dentistry, or were you trying to satisfy the Justin Moody's of the world?
No, the objective is really to be sure that all the dentists who are not yet equipped have the opportunity to have access to a very good product at a fair price. So I would say, I don't say that the Justin Moody of the world are not interested in that product. This would be wrong, and I'm sure that many of them will be interested. But our first objective is definitely that all the dentists who are not yet equipped have the opportunity to be equipped with a very good product at a fair price and with a full service. We think this is very important because we have experience, and we have made many market research, and we have discovered that 23%, do you believe that 23% of the CADs or the iOS that were sold are never used, or probably are used once or twice, but are never used on the long run. So we think that it's extremely important that we accompany the dentist in their learning curve of how to scan and how to scan on the long run. So we want to make the dentistry better, and we think that digital will help a lot.
Say that again. What percent you said?
23.
23% or what?
Yeah. Of the iOS that were sold, it was in 2018, were not used on the long run.
Yeah, that is the biggest joke in dentistry, that we all have a museum. We usually keep it in our lab of all the stuff we bought that we never used. The list goes on. And let me tell you something. If you're thinking about buying something that you might not use, like back in the day, microabrasion, I loved it. I was the guy who loved microabrasion. I mean, when I was all done with the prep, I'd get my Danville microetcher and I'd spray it all out and it just looked pretty and clean. My assistant hated it because she had as much hair as you do, and she had all that aluminum oxide all in her hair. She says, you're bald. It doesn't, but my gosh, there's so many things I bought. Dentists have so many lasers and CAD cams. So I want to ask you another question. When Money's the answer. What's the question to a big part in everything because we live in a world with unlimited needs and wants with finite resources. And, Gutenberg invented the x ray machine a long time before dentists were using it. And it didn't really get used until the first dental insurance company, which is what we know now of Delta Dental in 1948. With the longshoremen's Teamsters, the president of the United States at the time, because of World War II, had put a freeze on all wages. So the unions, it was against the law to go back and argue for more money. So out of nowhere, the longshoremen's union, which was the union of all the ocean around America. No ship got in or out of America without going through the International Longshoremen's Club. And they said, well, you give us dental insurance. So I'm like, well, okay. So they started the dental insurance company, and it was in the, Seattle is the closest American port to Hong Kong. And then as you go south, the angle gets wider. And so in Washington, Oregon, California, they started these dental insurance deals, and they just happened to cover x-rays at 100%. Oh my God, like a domino effect. Every dental office across America bought an x-ray machine because now there's a mechanism to pay for it. Since then, we've seen all the time that if something comes out, like right now, silver diamine fluoride is a great way to prevent decay instead of doing a very expensive pulpotomy and a chrome steel crown. But a pulpotomy and a chrome steel crown is several $100s, but the insurance company only pay you like $12 to paint on the SDF. Well, if you got rent, mortgage, equipment, build out, insurance, computer, I don't even know how this would work. Even if you thoroughly believed in it, it doesn't pay the bills. And but then there's other things that came out and they didn't take off. And one of them is CAD/CAM dentistry, Dentsply Sirona. It's been out forever, and I don't even think it's got 15% market share. So the question begs, going forward, do you think we're going to see more chairside milling manufacturing of crowns? Or do you think it's going to be more of digital intraoral scanners and sending it to a lab and let the lab do the crowns? Because in the time I've been a dentist for 32 years, the CAD/CAM seems to have hit a wall of about 15%. It doesn't seem to get past it. And when you talk about those machines that aren't being used, the average CAD/CAM is a coat rack right now.
My view is very clear. Is the second option. To be very frank, I don't believe that the milling machine. I don't believe that the dentist, technician. This is not this is not their mission in life, I would say, to make crowns, to have the exact right color. It's another job. So I feel that the dentists have a very important mission to deliver the best clinical prosthesis and the best clinical practice to their patient, and taking the best scan is part of their mission. I think to deliver a crown, labs will always do better.
So is that now what you just said? Do you are you talking to America, or is that what you also see in Europe?
It's the same. The only difference, and when you say 15%, to be frank with you, I'm not sure even that 15% of the dentists are using an iOS or a CAD every day.
Well, what would you say it is? 12?
Yeah, between 12 and 13%.
12 and 13? Yeah, I'll take that. That's the number I hear, 12 to 13%. I was just giving them the benefit.
I think we have the same number.
Yeah.
So it didn't
usage.
Work. It's not having a device in a cupboard. It's real usage. I think that this 12 to 13% is absolutely accurate. And I feel that with the fact that we arrive on the market with a reasonable price, with a full service, easy to use, plug and play product, absolutely easy to use and full service, I think these 12% may go pretty fast to 40%.
Okay, that's the second or third time you said plug and play. That means something to you. What does that mean to you?
It means to me that you unpack and you can start your first scanning in 10 minutes. Everything is ready to use. And if you want, I can send to you a video that shows that very precisely. It means what? It means that the computer is fully designed. It's not a regular computer from that you can buy in where you buy computers. It's a computer which is fully designed for a product and fully, I would say, equipped for a product. So all the links are done, etc., etc. And we sell together the scanner and the computer. And so it means very simply that everything works perfectly after 5 to 10 minutes. It means also, and I want to go back to that, that if you want to be sure that everything goes absolutely perfect in your clinic, it may be a good idea to have a specialist coming and say, okay, should you link that with that, etc., etc. And then we offer for the same price a specialist going to your practice 2 to 3 hours to be sure that everything is absolutely properly settled. But it's clear that it's a big difference.
And is Justin
Moody.
Moody, my Fireball cinnamon whiskey drinking buddy here in town? Is he your top clinician in America?
I would say yes. I don't want to be. I don't want to have a problem with the others, but I would say he's part of the top clinicians we have in the US. And Justin is a very good friend of. I work and I have a business partner with Joe Harms, who is important with me in this endeavor, and he's also a friend of Joe. So it's yeah. It's
What's his
we are
name?
working Joe Harms.
How do you spell his last name?
Harms.
Joe Harms.
Yes.
Well, because one thing I would recommend, one nuance of the American market is you have to take continuing education and you get credit for it. You ought to have Justin make an online CE course. Dental Town's made 400 online CE courses, and they've been viewed over 1 million times. And then with this pandemic, instead of having to go sit in a brick building in a big crowd, we're a virtual company. So this pandemic made Dental Town. It doubled the traffic, exploded. And Justin's right up the street from my office. You ought to have him make an online CE course.
He did one for us at the end of November, and we will deploy this process. You're absolutely right. The times are with digital, and we will, as I told you, we have launched the product 2 months ago, so it's very new. And for the time being, we have done some webinar with Justin Moody, and we will have more, I'm sure. And if we can collaborate with you, it would be with pleasure.
Well, right on, Justin. Just more proof. He's from Nebraska, and I'm from Kansas. So I just love it when some of us hillbillies from the rural flyover states make good. So this company, this product's been out a long time, and you switched. But today, what are you most passionate about right now?
In my job, it's very easy. This was a beautiful R&D company. I want to make it a real global, I would say, dental digital company. And I want to bring better care or better products to the dentist. I've spent all my life working with a long time of my life working for pharmaceutical industry. And every morning, my view was, okay, we will bring some good better care to the patient. And I think it's absolutely the same in dental industry. And I'm sure that with this product, with this team, we will do that. And for me, it's all my life. I work probably 12 to 14 hours a day on that.
And where does that and she just said something very, very profound that might have flown over your head, and that is she works all day, every day. I mean, a lot of kids come out of dental school. Now, I was lucky. There was this guy in '87. His name was Ed Silker, and he had what you would call the first DSO meaning a group practice, multiple location called Sunshine Dental, 4 locations, and they were open 7 to 7, 7 days a week. So when I was building out, I graduated May 11. I got my practice open September 21, and until the construction crew was done, he let me work 7 a.m. to 7 p.m. 7 days a week. And I felt so lucky because I was doing my dental school requirements. I had to do 55 fillings, 55 extractions, 15 canals of endo, 15 canals of 15 units of removal. And I was doing it every week. I mean, I felt like every week I was twice as good as it does. And now I see these kids come out and they're like, oh, they want to get a job. They don't want to start their own practice. Then they get a job. And I tell them, okay, look, dentists aren't born to take orders. So you either like giving orders and you're an owner operator, or you like taking orders. And they're like, well, I don't want to deal with all that. So they go take orders. And they find out, oh, dentists, physicians, lawyers, they're not good employees. They hate taking orders. And so they quit their job. And it takes about 5 years and 5 jobs before they finally get so miserable they start their own. And then when they start their own, they start with Monday through Thursday, 8 to 5 with 3-day weekends. I mean, damn, they don't hustle. And when you ever meet someone as successful as Marie, they're not just smart, they hustle, they work hard. And I had a dentist the other day at lunch. I almost wanted to punch him. He got me to go to lunch with him because he wanted to cry to me about, he got out his little violin about he can't find a job and he's got all these student loans. And within 3 minutes, it finds out he indeed did have a job offer, but it was at a Medicaid clinic, and it was just a bunch of pulpotomies on kids, on poor people. And I'm like, dude, you're a fireman. That's a house on fire. You're a policeman. That's a bad guy running down the street. You would rather sit home and complain until you get a job that pays you enough. You're lazy. You're dumb and lazy.
Two things. I am 100% with you, 1000% with you. I think two things. First, it's a real luxury to be passionate, and I'm passionate with what I do. And I think it's a big luxury, and I'm so grateful to life to have the pleasure to do that. So this is my first. I think it's important to feel that we have some chance. And the second is that what is important is everything we do, we try to do it the best we can. It's difficult because some days we fail, some days we fail miserably, some days we are successful, which are not perfect. But I feel that what is important is to do the things the best we can, and then we have no regrets.
So when you're in America, by the way, next time you come to the United States, have you ever been to Arizona?
Yeah, of course. I've spent basically 60% of my time in the US and 40% of my time in Paris or in other parts of the world.
Yeah,
so
well,
now I am in Paris, but I spent the last 3 months in Washington.
Well, I want to come back to Paris. When I lectured in Paris, and I did like 3 podcasts there, the Pierre Fichard Museum was closed for remodeling. I'm like, okay, what did I do? What did I do in my previous life that brought that cursing on me? But when you're in the States, do you ever see that show called Shark Tank?
No.
Yeah, okay. So it's one of the biggest hit shows in business for like 8 years, where they have like a panel of like 5 judges that are like billionaires and multimillionaires, and you come and you pitch your product, and they're either going to invest in you or not. And they've made a bunch of millionaires, and it's so great because it's like a job interview when you're trying to get a loan. I mean, they ask the most brutal questions. And my favorite guy, the smartest one on the panel, is obviously the only bald guy on the panel. You'll always notice the bald guy is always the smartest one in the room. And his nickname is Mr. Wonderful because he's so brutal. And he's from Canada, which doesn't even make sense because they're like the sweetest, nicest people in the world compared to Americans. And if he doesn't invest in you, he says, "You're dead to me. Get out of here. Get off the stage." But the first thing he's always going to ask is, what is your unique selling proposition? You're not the only intraoral scanner space out there. There's a dozen of them out there. Marie, what's different about you? What makes you different and special?
We provide the first digital, purely digital, and very easy to use iOS for all the dentists of the world.
I know my homies and the young ones. There's a mental divide in their brain about open software closed. Like I like iPhone, it's all closed. But the it only has like 15% of the market. The other 85% is Android because it's open. And what I like about the Dentsply Sirona CAD CAM is that it's a closed system and someone like me could figure it out and other people can figure it out. Then I go over to my friend's house who drink the same whiskey and they tell me about how they like the open platform. So I just say, okay, well, you just took a CBCT on that lady, print it out. I want to get a second opinion. Print it out on a CD-ROM. And no one in the office can figure out how to do it. And I'm like, well, usually if you like open software, you should be like a techie and a nerd and a geek and love to figure this out. But what I see in dentistry, they say, well, I don't want to get it into a closed-in systems because I'll be locked into that company. So I'm going to buy another, I'm going to get a scanner from one company, a printer from another company. I'm going to have like 5 different pieces of equipment and nobody in my town will know how they work together. So would you consider 3Disc a closed system or an open system?
Open system. By essence. By essence means by wish, by definition, and we will have an open system forever. Because we feel that the world is going to be opened. I am with you. I have an Apple, I have an iPhone, and I love my iPhone. But for the dental world, I think it's different because everything is linked together, or everything has to be linked together. And the standards are different from one company to the other. And I think it's extremely important that each dentist has the possibility to have a system which goes with product A, B, C, D, etc. And by the way, one more complexity on this for this product is the fact that they have to be linked with the labs, which also have their different, I would say, standards. So we have a system which is absolutely fluid, means it can go with absolutely everything in the dental practice, and it can go with all the products in the labs.
That's interesting because I have to tell you that was shocking to me because in my walnut brain, which doesn't even show up on an MRI, I always think open systems are harder to use and closed systems are easier to use. And you're telling this old dog that you got an open system that's very easy to use.
Absolutely. And this is the revolution of the digital. This is why we can speak of evolution or revolution. I don't know. I'm not sure that the word is perfect, but okay. I think it's this is the most difficult, but it's the real objective is to be easy to use, but totally open. Well, and that's why I insist so much on plug and play, easy to use, open.
Well, now I'm going to hold your feet to the fire. Which is it? What do you consider yourself, an evolution or a revolution? Because the word evolution refers to the gradual development or changes in something over a period of time, which sounds like you're a high-tech company just incrementally going. Whereas the word revolution means a turnaround, a sudden and complete radical change. So, or do you consider yourself an evolution or a revolution?
I think it's a very good question. I think that for the dentist, we will go from a manual printing to a product era. It will be a revolution. But I think on the other side, if you compare our product to the competition, it's an evolution. But it's an evolution which is significant and which is, I would say, clinically significant. It's not only significant because some technology have changed. It's clinically significant. And this clinical evolution will allow a large number of dentists to be equipped. And for them, it will be really a revolution.
Wow. I can tell you've thought about this before. And when you think about this here on intraoral scanner, are you thinking like crown and bridge and implants? Are those the procedures that kind of define this intraoral scanner to you? Crown and Bridge, restorative dentistry. Is that the lion's share of your thinking on this?
Yes, but it's not only. We can absolutely do orthodontics with it. It's easy. It's already it's done for that. But what we have noticed is that I would say the dentists to which we sell this product are using it 90% or 80+% for crowns and bridge.
80%?
Yeah.
Crowns and Bridge. I'm going to ask you another thing. When you look at dentistry, which was started in your country by none other than Pierre Fichard, the first man who wrote a text, and by the way, that's why when you say to me that orthodontics is a specialty in dentistry, I'm sorry, but Pierre Fichard already showed you that dentistry was a specialty of medicine. So all the 12 specialties are subspecialties of dentistry, which is a specialty of medicine. Please get that right. And by the way, to the specialists, I'm sitting here in America where we have 12 specialties. Marie's sitting in France where they only have 3. So at the end of the day, dentistry is the specialty of medicine. And when dentists tell me, well, I don't want to learn about implants or TMJ because that's not what I'm going to do. Dude, you're still the quarterback. You're still the doctor. You're a medical specialist, and you can't rely on all these specialists if you don't know the diagnosing and treatment plan. You got to know a lot just to be able to say, hey, I'm going to take this patient, I'm going to pass it over to an orthodontist, oral surgeon, pediatric dentist, oral medicine, whatever. But that doesn't excuse you from not understanding the didactics of all these 12 specialties, because that patient's sitting in a chair and she thinks she's sitting in Pierre Fichard's chair, and she thinks he was all the early leaders in dentistry. The first president of the ADA was an MD and a DDS, and that was honorary. The current president of the ADA is a MD oral surgeon and a DDS, and I don't care about 12 specialties. It's like when you go to court, not knowing the law is not a defense. You can't sit there and say, well, I didn't know you can't steal cars. I thought you can't steal candy bars. Really? Oh, well, sorry, excuse me. No, it's not an excuse to not know the law. So you're the dentist, you're the subspecialist, all the leaders are doing that. But then America, 100 years later, by the way, when the Pilgrims got here from Plymouth, England, the first dentist didn't come from England for almost a century later. G.V. Black was our Pierre Fichard about 100 years ago. But since my lifetime, since I got into dentistry in 87, the dental industry is a very old, 2-century-old industry that pretty much grows with the rate of inflation of an economy, with the exception of 2 areas, and that's clear aligners and implants in double-digit growth. So, and when you go around the world, I gotta take my hat off to Invisalign, because I've lectured in 50 countries, and every bartender in every one of those countries, the minute they found out I was a dentist, said, ask me an Invisalign question. That brand is huge. But I want to ask you specifically, and I know we come up on an hour, and I know you're in France. It's 3 here, so it's 3, 8, 9, 10. Is it midnight there or 11 o'clock?
No, it's 11. It's 11 okay. O'clock. It's okay.
I'm so proud. I'm going to tell Justin that I kept you up past your bedtime. Then just leave it at that. See what he says. I kept her up till midnight. He's like, what? But what would my final question, what advice would you have to the young dentist? Because if you stay in cleanings, exams, fillings, and crowns, you're in an industry that just pretty much flat grows with inflation. But if you branch out to clear aligners, I think of the soft and pretty bleaching bonding veneers versus the blood and guts, root canals, extractions, implants. You can even see it in the root canals. When you get some bleaching person to do a root canal, they stop like a 0.5 millimeter of the apex and make it all look pretty. When you love to place implants, you're an apical barbarian. You always want to puff a sealer out the apex. Would you advise them to go into soft and pretty clear aligners, bleaching bonding veneers, and will your company have any support for that? Or do you think the better opportunity to pay down $400,000 in student loans is to go into public health? That you come into my office in pain, I can extract it, I can root canal it, and after I'm done extracting it, someday I can replace it with an implant. What would your advice be to these scared young kids with $400,000 in student loans?
My advice would be that what they choose to do, they do very well. My advice, I can't say you should go in this. I can't say to everybody you should go in this field or in that field. I don't feel that it's the right answer. I don't think it's the right answer because probably it's a matter of what these person prefer in terms of, I would say, type of clinics, etc., etc. My advice is when you choose something, make it perfect. And I am sure that if you do it better than your colleagues, then reimbursement of your loan will not be an issue.
Nice. And I love that because it's so true. It's you got to believe in dentistry. I mean, my God, when someone has a toothache, they wouldn't care about a famine where a million people are refugees. I mean, they just got to get that pain out of their face. They're in so much pain. That's my cup of tea. When someone comes in, I love it when they still have they have to have a cup of cold beverage with ice just to keep the pain away. And it's like, my God, I've been waiting for this toothache my whole life. Love every one of them. And then if you can extract the tooth without them knowing it, which I can do all day long, it's so great because what I do is when they're numb, I tell them, I said, well, I got to make sure you're numb. See, there's 5 types of nerves. There's hot, cold, movement, pressure, pain. I'm only numbing up pain. You could still feel hot, cold, movement, pressure. So I'm just going to push pressure around the tooth to make sure you're numb. And of course, that's the periosteal. I'm separating it. I'm elevating it. And then I say, well, then I'm going to just wiggle it. I'm just testing if it's numb. And then you're elevating one side or the other. And then when you finally get out, then I stop and say, well, Marie, you know what? I don't think we should pull the tooth today. In fact, bite down on this gauze. Have them bite down. They're all like shock and everything. And I say, you know what? Why don't you come back tomorrow and we'll try it again? And then they're like, okay. And as soon as they agree that they'll come back tomorrow, then I hand them their extracted tooth. So they have to, I don't care what you say, dude. I just pulled your tooth and you didn't know it. And that is the championship game for me. And then if it's a child where the parents didn't come back, I explain it to the mom in front of the child, and we decided we're not going to pull the tooth today. And then I hand the little deal to the mom, and she opens up and sees the tooth, and then she realizes, and everybody in the waiting room realizes, that little Amy doesn't know how he just pulled her damn tooth, and she's saying she's going to come back tomorrow. So I love the blood and guts, but the second part of that question was, will anything in 3-disc in the future go towards the clear aligner revolution? Is that going to be part of your deal, or is that not a part of your business model?
No, it will be. It's part of our thoughts. Not to go through clear aligners. We want to remain digital. Our life is to be digital, and we think that digital will be part of many practice, and we work on many things. It's a little bit confidential, as you may imagine, but being digital means that we will work in many aspects of dentistry, and not only in iOS. I would say iOS or crowns. We definitely want to go broad.
All right. Well, if you, I know it's confidential, but if you tell me right now, I promise I won't tell anyone.
Of course. Of
My
course.
gosh, that was I cannot believe we went over an hour. Was there anything, Marie, that you were wanting to talk about today that I didn't bring up that you wish I did, or?
No, you are an extraordinary journalist.
Well, thank you very much. I like that.
It's a difficult exercise for me, but with you, it's the English language makes it also very difficult. But with you, it's all right. It's all right.
Well, thanks. And my gosh, I try really hard to be a dental journalist. I own my first magazine. Well, what my dental journalism? I've never even mentioned this. You're the only one who's ever brought up. I was wrote up and was published 4 times in the Journal of the American Dental Association. And every time I would get the copy in the mail, I didn't even recognize it was from me. They're like, well, Howard, you can't say that. You can't say that. You can't. And after they watered it all down, I said, I know these dentists. They're not morons. You treat them like they're a child. You can say a product is horrible. You can say something is crazy. And finally, I realized that due to my strange personality, the only person that was going to publish me word for word was my own. So in 1994, I started my own magazine because everyone else is going to edit it down. And that's what I'm going to say to my viewers. I'm not here to make a friend. I believe that if I really love and respect you, I'm going to tell you exactly what I think. And if you don't agree with it, of course you don't agree. There's 8 billion people, and they worship 1,100 different gods. My 2 oldest sisters are Catholic nuns. I don't agree with 90% of what they say, but I still love them to death, and I still tell them what I absolutely believe. They tell me what they absolutely believe, and we love each other and cook dinner, and I think my sisters would be very insulted if they thought I was holding back and not telling them what I thought, and I would feel extremely insulted. So if I love you, I'm going to tell you what I think because I'm trying to help you. And if you don't agree and you say, well, that guy's crazy, my God, if you think I'm crazy, you need to meet my mom. So on that note, Marie, thank you so much for staying up way past your bedtime. And my gosh, for sharing your wisdom. I can't believe I got you to come on when you were the CEO of Acteon, and I got you to come back again on 3Disc. But when that Pierre Fichard, I got my vaccine yesterday. So when that Pierre Fichard Museum opens back up, man, one of my first flights is going to be back to Paris to see that museum.
I will be very happy to welcome you if at that time I'll be in Paris.
All right. Well, until we meet again in Paris, have a great rest of your evening. I hope you go straight to bed.
Yeah. Thank you so much. Thank you.
All right.
It was a pleasure.